Hello, this is Kunal Sarkar. I'm one of the cardiac surgeons from Calcutta, and I think 25 years of cardiac surgery in India, in Calcutta, has been a very fulfilling challenge. And I embarked on this journey after 11 years of training in the United Kingdom. I was the past president of the Indian Association of Cardiovascular and Thoracic Surgeons, and thanks to the support of my colleagues, I am currently the president of the Society of Coronary Surgeons. If you look back beyond the last 25-30 years, you see tissue valves were not of great quality because there were a couple of very primitive tissue valves which you could use, but they would not last for more than about 5 to 6 years at most. So surgeons by and large were left with the choice of either a very short-term option for a tissue valve or taking the risk and hazards if there would be with the conventional mechanical valves. With the improvement in tissue valves, the durability vastly improved, and we have started to expect 15 years, in and around 15 years durability with good physiological and hemodynamic performances from the tissue valves. But one specific issue with the tissue valve persisted, more so with our patients with the Indian subset. Why? Because our body sizes obviously is far smaller than a typical Caucasian body size, and because of which whenever we were faced with a tissue valve implantation, for example, if you consider putting in an aortic valve in a 19 size aortic annulus or smaller, now that used to be a very tough job. Either you made the surgery a little bit more complex with the aortic annulus enlargement, which is not a tremendously difficult thing, but it does make the operation longer and a little bit more complicated. In that respect, I think the Dafodil NEO has really been a big blessing, a big relief, because Dafodil NEO has given us the solution of a tissue valve in smaller size with what appears to be patient-friendly hemodynamics. The effective orifice area, the early residual gradients in the aortic outflow tract so far seems to be quite acceptable. We have used it. The use of implanting the Dafodil NEO is quite acceptable, and once we have some of our own data and match it with the data of our colleagues using this valve, we are very, very optimistic that with good results, the uptake of the Dafodil NEO will increase. We have put in a few Dafodil NEO valves in women who were very symptomatic with severe aortic stenosis, who were almost having surgery at the NYHA4 level, patients with very limited mobility, small body size, and some of them were threatening to get into other problems like early renal compromise. So when we have followed them up, I think the follow-up we have with Dafodil NEO is about 6 to 8 months now. We haven't yet gone into the 1 year, 2 year follow-up, but in the early follow-up period, we are reasonably satisfied with the patient's rehabilitation, their quality of life, and we are keeping a very close eye on the echocardiographic characteristics of the Dafodil NEO, especially in size 19 and lower, and keeping our fingers crossed. So far, the figures seems good. Dafodil NEO is a very, very strong consideration in people in whom, either for age or for their medical conditions, we are considering a tissue valve, and where the preoperative echocardiogram suggests that their annulus may be somewhere around the 19 range, and we may not be having the liberty or the luxury of putting in a 21-23 aortic valve. Such type of patients are not rare in our Indian community by any means, and many a times, even though we had planned a tissue valve, we had gone in and put mechanical valves of smaller size by compulsion. So I think let us wait and watch and see if the 1 to 3 year data from Dafodil NEO is good on echocardiographic and symptom relief terms. I think a very important riddle could have been solved. So for surgeons, I think we are extremely hopefully looking towards good outcome from the Dafodil NEO, because a very important step would have been taken where people who would truly benefit from a tissue valve implantation with severe aortic stenosis, low annulus size, that big hurdle would have been overcome. This particular valve, Dafodil NEO, which is manufactured by Meril, one of our most trusted companies from our own country, offers to give a very good solution, and this will be a big blessing not only for the patients, but would have solved a big problem that surgeons were facing for a good part of last 30 years.